Hi, good evening. This is Sheila again. It's October 30, Wednesday, and it's exactly 14 days or 2 weeks after my right shoulder surgery. Sorry. So I just want to give you a quick update. I did not record in this last couple of days because there really has nothing new that has happened. I am still doing my therapy twice a week, and the last therapy I had last week was Thursday, so I came back Monday, and according to this is probably giving you some weird sound, but according to my therapist, I did pretty well, considering that I have 3 days gap. I have been diligently really doing my exercises at home about 3 to 4 times a day. Even though I get sore, I just keep icing, and between cold packs and warm packs, I've been doing that. As far as the pain is well controlled, there's still the tightness and those excruciating on and off intermittent like stabbing pain that you feel from the bone, but it goes away. I didn't have to take any medications for it. I just ice it, or I just get like a local cream, like this arthritic pain relief cream, just a little bit, and then just lightly just rub it on the surface. I don't really mush it, just light rubbing with the ointment, and it seems to calm it down. So that keeps me away from taking extra oral pain medication. I'm still on the naproxen, 500 milligrams twice a day. I have not taken that oxycodone as needed, and I have been weaning myself off of the Tylenol that I can take in between. So no nausea and vomiting, GI is so good, no signs of bleeding, from the aspirin. I'm on blood thinner, 325 milligrams aspirin until through today, 2 weeks exactly, and then tomorrow I can stop it. But I'm regularly on an 81 milligrams, so I'll just go back to 81 milligrams aspirin. What else? So I have more range, but it doesn't stay there. Like, what I mean by that is, on the next session that I do, I start kind of tight again, and then as you move and as you stretch, then you stretch, the angle. Let me see if I can kind of show you the angle where I can, open up my arms like that on the right becomes better, the angle that it opens up my arms, but it becomes tight. So that's why I have to continuously do it throughout the day and every day. And that's why I took off, because there's no way I could do this if I'm 8 hours working. And plus, I have such limitations. I'm still non-weight bearing in this. I still have a lot of motions that I can't do with abduction and all that, which I need to do my job. I can, do some fingers, but that's not all you do. I don't just type. I do a lot with the mouse and navigate and stuff like that. And I just don't have that range yet. And I don't want to snap anything, from their attachment. So anyway, I went to my 2 weeks post-op follow-up yesterday. Yes, yesterday. And everything's good. She explained to me the pictures of what they did. They sent me some pictures, and she also showed it to me on the computer of what they did. So they did a lot of work. Like, it's a mess. My shoulder was a mess. My supraspinatus tendon is completely torn. It was flung in the back, and then the subscapularis is partially damaged as well, and the infraspinatus in the back is partial. Also, there's a lot of frayed fat fibers, a lot of those, and then I have a bone spur over here. They have to shave off. They have to clean it up because there's so many fragments of whatever remnants of the tendon that was torn. So they have to clean that off, get the area ready, shave off the bone spur, and then they put the anchor where they're going to reattach the tendon with suture. It's not a metal screw or anything like that. for what she explained, it is something that made out of calcium or something like that. I can't remember exactly what is it made up of, but it heals with the bones. It's not something that is a metal that I will have restrictions with MRI, or I will bling 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 in the x-ray, in airports and stuff like that. Nothing like that. So it becomes one with the bone, with the suture. So it's a very tight, it's a very secure anchor. And the knot that she showed me, the way she explained to me, and I've seen it, is a very tight suture. Hang on. And another thing that she explained to me is my biceps. She showed me the picture, the before and after. The before was horrible. It was very inflamed, red. You can see red, like red meat. And that's despite the fact that I have been taking consistently anti-inflammatory, and however, I have been dancing for the last 2 years. Every week there's practice, there's hand movements, there's all those repetitive movements. So that's why I think it got a little bit really exacerbated. And then I had that motor vehicular accident, a turn turtle, about 2 or 3 years ago. Anyway, it was ugly. So what she did is that insertion, the tendon, the long head of the biceps, she cut it off, and it was the picture was there. It's red and very thickened, very inflamed red. Took it off, feed it to the fish. We don't need it, right? So then she reattaches it. Instead of putting it back in the groove, she put it a new anchor. She reattached it low at the humerus, closer right here. That's why I have this suture right here. And so because of that, of course, then there's no weight bearing on this. That's gotta take 6 weeks, this and that, 6 weeks to heal, so that we don't snap them off their attachment. And then she also took all the stair strips that was left here. She took them off because they're not coming off there on their own. I have taken showers. Oh, by the way, I've taken a shower by myself. Yay. So she took off the stair strips and she looked at the incision. She said that's normal, it looks good. Apparently the suture here was glued. That's what I thought, because there's no suture, there's no staples. It's just like a plasticky thing over it, and I know they glued it. So, and as far as therapy is concerned, I am where I'm supposed to be at 12 days or 14 weeks. In fact, I'm doing really good, apparently, with the range, the range. However, it's very weak. I have range when we work on it, but it's very passive. There's this, you got to remember, this is passive movement. I'm not actively moving it. I'm like slowly stretching myself. Passive movement. I am moving my arm with my left hand. So no active movement. So yep, I'm going to be here trying wait for this to heal before I could do other stuff. So really, that's good. And she let me drive. She said I can drive, but I have to take off my sling. And I cannot use my right hand like this. All I can do is maybe if I need to, is to make sure I'm not flashing you guys. Like the bottom, I have to stay low. I can only do this low, and if I need to do a little steering wheel, just a little bit of support here, but I would still be basically driving with my left, and which I do anyway. Most of the time I do just like relax and do that, but in case I need to have two hands, this is full range, but I can't do that. So having said that, I can drive. I am only driving to my doctor's appointment, to my therapy, maybe basic groceries, maybe, but nothing far, hours of driving, not driving a highway, not yet. Luckily, everything that I need, all my doctors, my therapy, grocery, church, bank, anything, dentist, is within 2 to 3 miles. where I live. Everything is around here. So that is good. It's such a blessing. And also she said that if I'm sitting down, I think I mentioned it in the last time, I can, kind of give myself a rest, a break from this, and I could just prop my arm on a pillow if I'm just sitting down. But if I have to walk around, I have to be on a sling. But the addition is, she said, if you're not a fussy sleeper, which I'm not, I usually stays in one position, and I'm a back, and I am a back sleeper and a left-sided sleeper. I can take this off at night. Oh, how nice. Yeah, but I chickened out last night because just like what my therapist said, you're going to be so sick of this sling that you cannot wait to get out of it. But once you do, it's another story. You would want to get back on it, which I can understand. My arm gets tired. Like it feels tired. It feels like it's lots of tension here. So I still put this for comfort. I say when I'm walking around. But if I'm sitting watching TV and I'm going to be there for a little bit, I kind of take this sling out of my shoulder to give my shoulder and neck a rest. But I still keep this in place. So I really don't want to tear this up, and I don't want to do the surgery again. But overall, so far so good. Hopefully, I have another about 4 or 5 weeks, and I'm hoping that I would gain more range of motion and a little bit of strength, that I can do what I need to do without hurting this. I might start with intermittent, like shortened hours, because I think I can do 8 hours doing, just see right now, just doing that motion, I feel like some spikes of pain right here on the muscle. This whole area feels like it's really got bitten up, from the surgery, from all those repairs, and they're arthroscopic. Yes, they're the what do you call this? The incision is very small. See, sorry. They took off the what do you call this? The stair strips, and that's how it looks like. It is very small. I don't know if you can see. My hair is in the way. I'll show you the one front. Yeah, see, it's a very, and they put like a scope in there with a camera, and then they also put all these gadgets inside those. I have 4 more here, so I have 1, 2, 3, 4. So they work on it arthroscopically. Yeah. No wonder I was so sore. Amazing, huh? Little incision where they, prepared, cleaned up, and shaved off my bone and reattached and sutured and this and that from those little openings from a scope. So, which is a lot better, because in the older days, they would open you up, like they move the biceps out of the way, and those are long incisions, layers of muscles where they have to go through and cut through, and that will have to heal. So the healing, as far as the incision site, is of course a lot faster and less trauma, I guess, from the surrounding structures, whether it's done arthroscopically. But still, it hurts. It still hurts, and I've talked to a lot of therapy friends, and shoulder surgeries are the longest time to heal, the hardest to heal, versus a hip replacement. I agree. I've seen that. We don't, this is a shoulder. It's a lot. It's so complex, the way our shoulder works. So, I feel that pangs of pain. Anyway, that said, it's getting cold now. It's actually snowing outside. So it's probably why I'm having more pain. I can feel it. So anyway, God bless everyone. Until next.